Hi, Virginia. And hello, Kentucky. It is 5 o'clock. That time we get together and make sure that we are committed to defeating COVID-19 on the very first try. Let's start the way we always start, that we will get through this, and we will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. And we're going to get through this together because we have come too far and we have done too well to stop now. You, the citizens of the Commonwealth of Kentucky, are taking on a pandemic that happens once in every 100 years. And while we have lost too many, you are doing something that this world has never seen, and not just flattening but plateauing the curve here in Kentucky. Your actions every day are saving lives. And as we begin to make a slow, gradual transition from healthy at home to healthy at work, we need you now more than ever to be bought in and to be committed and to make sure that we do what it takes to protect one another. You are not just passing, you are acing that test of humanity, but the test isn't over. So we got to make sure that we continue to do what it takes, and because when we look back and someone writes our history, I believe that this is our moment to prove that not only are we a special generation and a special people, but that we are willing to sacrifice and to persevere, and that we have the strength to ultimately defeat COVID-19. We're going to get through this because we're going to continue to remember the 10 steps to defeating the coronavirus. Those 10 steps start at being healthy at home, and that's not changing. We'll talk in a little bit about how our numbers of contacts increase as we go to being healthy at home to healthy at work, but that means when you're done with work, you got to come right back and be healthy at home. Avoid crowds and gatherings. This is going to be when you're at home. This is also going to be when you're at work, changing the way that we go about things at work. There is no reason to have an in-person meeting at work when everybody, if they do, has a telephone and you can do it remotely. Practicing social distancing, knowing when to seek care, kycovid19.ky.gov. That's going to be the official place to go and to see the regulations and the requirements to make sure that you're meeting them as we go to healthy at work. Washing your hands and surfaces, more important every day, especially as you'll have some more exposure. Apply for benefits. We'll get a UI update, but make sure you are applying not just for unemployment if you need it, but also for Medicaid and other benefits. Prioritize your mental health. Really important for all of us. And I mention every day that we need to do this for citizens, for all of us, and I need to do it too. And so it is Thursday. I'm going to let you know that for the first time since we reported the first case, we're going to take a day off on Saturday from doing the briefing. So we'll have one on Friday and we'll have one on Sunday. It's going to be a beautiful day. It's normally Derby Day. We know most of you are going to be healthy at home or getting exercise. And in a step of self-care, I'm gonna get a little time on this Saturday to myself as well. I hope you understand. Do not travel and report non-compliance. Those 10 steps are what you have been doing each and every day to make sure that we win. And it's not just you doing them, it's you being the example so that other people see you doing the right thing and want to be a part of that, want to be a part of this unity of Team Kentucky. So we ask every day that you don't just do your duty as a patriotic American and as a Kentuckian, but that you model it for others by using these hashtags, Team Kentucky, Together KY, hashtag Patriot, and hashtag Healthy at Home. As we are gradually going back to work, let's start saying healthy at work and making sure that we are modeling at work and we're putting it online for others to see. And we're putting it on social media that work doesn't look the same and we're doing what it takes to make it safe. So here's a little of what we have from across the Commonwealth today. All right, this is the Laurel County Frisky, one of the most important organizations, units, not just in public education, but everywhere in Kentucky that truly look out for our children and make sure everybody has real opportunity. We appreciate their work. We support them just like they support our kids. All right, this is, again, an example of the sacrifice that we have seen in our houses of worship, making sure that our people are protected and that congregations, during this time of a virus that is very contagious and can be deadly, especially to certain populations, we have seen sacrifice by our faith leaders and our houses of worship. So, as you know from our schedule we released yesterday, we're going to be able to do in-person worship services with significantly less capacity here soon in May. But until then, we really want to encourage everybody to continue with virtual and drive-in services, two options where people can still worship and give us just a little bit more time, both for the virus and to work directly with you as faith leaders to make sure that we have the best policies in place. Now, this is another one of those moments. This is a 54th wedding anniversary. It's being missed. It's not many people that can say they've had a 54th wedding anniversary. But this is somebody making sure that that person who they've been married to for 54 years is safe. Now, let's make sure that we continue to do our part to recognize this sacrifice. All right, our healthcare heroes. This is, again, just an amazing group of folks that show up every single day, knowing the risk that they face, but doing it to protect all of us. We need you to be healthy at home and healthy at work to protect them. All right, again, this is one of the toughest parts of this, is especially with families with young kids. My family has young kids, but amazing to see the ways that they can channel their energy into such positive expression, to find a little bit of joy and here express their gratitude. All right, and this is in Smiths Grove, First Christian Church, lighting up green, the color of compassion. This is something that we have done uniquely as Kentuckians. It's just something that's been between us, and it's something we've done for each other to show everybody that they're not alone, and if they are a grieving family, that while we can't be with them at a normal funeral or visitation, we are thinking about them and that we are with them. Also the color of renewal, because not only is each person we losing going to a better place, but we're going to have renewal here in Kentucky. We're going to come out on the other side of this. We're going to rebuild, we're going to restart, we're going to be as strong as ever. We have to continue to have faith in that. All right, so we talk about our 10 steps, and we ask you to show them on social media, but the 11th step is filling out your census. All right, I got a report that Oregon caught up to us. We've gone past them. We are still in 16th place, but we are now in a tie with multiple states. We got to do better. So I need you to go online if you haven't and fill out your census. Again, they are federal dollars. The amount is determined by how well we fill out our census. Now, let's not leave dollars on the table, especially with where the economy is right now. This is being part of Team Kentucky as well. And it's not just us that need you to fill out the census. So much that deals with dollars that go especially to help our children is determined by the census. So we got a couple kids today that are going to help remind us of our duty.
Hi, I'm Nick, and and I'm gay. And I want to say, our father and our dad are right here. But our parents are educated. It's just that accuracy is that we're inspired to do that. The best thing is just remember, everyone counts.
Planning and patience. And today we're going to learn perseverance. Perseverance. One more time. Perseverance. And so for everybody, Virginia, if we can do the three again. Sacrifice, planning and patience, and perseverance. Thank you. All right, let's start by talking about testing. We announced yesterday our testing locations for next week for our Kroger program, and there are still significant spots left. In Ashland, for next week, we have 1,039 spots still left. James, can you put up the Kroger sign-up slide? So anywhere in the Ashland area, if you are close to Ashland, we want to make sure that you sign up and you are able to get tested. 1,039 spots that we need to fill. They are open right now. In Louisville, we still have 600 spots left next week. It's primarily next Thursday and next Friday. Let's make sure that we sign up and get those filled. In Lexington, we have 800 spots left in Kroger. Let's make sure that we get those filled. And in Bowling Green, we have just 400 left because of the way that signups have gone. But let's make sure, as we're trying to amp up our testing capacity, that we get each and every one of those filled. Now, if we go back to our other slide, I think we're having a couple technical difficulties. This shows you where we have testing, certainly this week, and every day we have new ones that come on board. In 202 to talk about Jessamine County and Owen County. I believe Jessamine is going to be next week, and Owen County is just tomorrow. So those are two that we want to make sure that we take advantage of. I think we've got a separate slide, but again, we're having a few technical difficulties. There you go. So this is the information. Owen County is just going to be tomorrow, Friday, May 1st. Take advantage of it. Jessamine is an everybody must register. Owen is taking anybody that pulls up. So next week, Tuesday through Friday, Jessamine County Health Department is going to be putting on testing. And then tomorrow, Owen County through Three Rivers is hosting testing. Let's make sure that everybody has an opportunity, that they sign up, and that we get the type and level of testing that we need. Next announcement for today involves
system where they can use vaporized hydrogen peroxide to clean N95s, and they can be reused up to 20 times. The federal government worked with Battelle and funded them to provide this as a resource to communities who needed to respond to the coronavirus. So as of April 29th, the information Battelle has provided me is that they have installed these in 11 locations and have 17 more that are going to be installed, and we are one of those. So my colleague, Director Michael Dossett, who's the Director of Emergency Management for Kentucky, put us at the top of the list by submitting very quickly when this became available. And so we have one of these now installed at the Expo Center at the Fairgrounds in Louisville, and it is planned to be operational for next week. So if you are a hospital, and James, I don't know if you can show that Battelle slide. So if you are a hospital, a doctor's office, a dentist, anyone who uses N95 respirators, you can go to the Battelle website, although this is not, we'll get it to you. I think the slide we have here is a different one. So it's www.battelle, BATTELLE.org/decon, DECON. And we'll post this on the website, and we'll send information out through professional associations. We want everybody to use this. This is easy. Once you sign up, they send you return shipping labels and materials. You label the N95s. You ship them back. FedEx takes care of the bi-directional shipping. That's all paid for. You don't have to pay for that. It's gone for probably just a 2-3 day period, and you receive it back, and then you can reuse the masks multiple times. So we need everybody to use this resource. We have to maximize our N95 respirator supplies while we still try to acquire more of them to build up a resource should we need them at a later point. And the last thing, I was asked to talk about pools. Look, when I grew up, I went to my grandma and grandpa's house. It was right across the street from a public pool and a public library. And I've already told you how I enjoy my books and my reading. So if I didn't spend time at the pool all day, I was at the library for the other part of it. I know what it's like to grow up as a kid in a pool. It was a really valuable part of my childhood. Not just because of the pool water itself. There's just almost no way you can put together a whole bunch of kids and people at a public pool and not have folks socializing and violating the social distancing rules at greater than 6 feet. It's just not pragmatically possible. So public pools are not something we're going to see, certainly not in the early part of summer, and it's too early for me to predict anything other past the middle of the summer, but certainly not in May and June. Public pools just are not going to be possible. So thank you very much, Governor.
All right, and just to add on to that, that also means any communal pool, right? Apartment complexes and the rest. Those right now are areas that we believe would significantly spread contacts, prevent us from being healthy at home when we're not healthy at work. So let's be smart. Let's not try to be the exception. Remember, by saying I'm not a public pool, I'm an apartment complex pool. Same problem in those types as well. We want to make sure that we are safe and operating safely. Now I'm told that we had some problems with the mic earlier, so I'm going to go back through testing just very, very quickly. The Kroger testing for next week, there are still significant spots that are available. So if you'll put up how to sign up, Ashland, 1,039 spots. So that entire area of eastern and northeastern Kentucky, let's make sure we fill that up. Louisville, 600 spots left. Lexington, 800 spots left. And Bowling Green, 400 spots left. And then we just, again, that's how to register. Then we briefly went over our two new sites, Jessamine and Owen County, and I'm told that Owen has now fully filled up. All right, so we talk a lot about healthy at home, and then we just started talking in the last couple days, but certainly yesterday, about being healthy at work. And we've got to get this right. We've got to start gradually and with strict rules reopening. At the same time, we got to protect everybody's health and make sure that we don't frustrate the sacrifices we have made to date. And that's why yesterday we put out a schedule starting on May the 11th of a very gradual reopening of our economy in which we call Healthy at Work. And for each area that we talk about, there's going to be specific guidelines that we work with the industries or the associations, and then public health ultimately signs off on. So this was May the 11th, and I know people are already working towards that date, May 20th, and then May the 25th. And for those that especially are on May the 11th, please remember that work has to look different. So we've received a lot of great proposals, a lot of people who are really thinking through it. But I will say I saw a proposal today that was kind of an office-based professional setting. And it basically said, well, we're going to stay 6 feet apart, and in common areas we'll wear a mask. We don't want to do temperature checks. We'll look at the office and decide if we need to rearrange it. And if anybody's high risk, well, we'll talk to them about it then. That is not a plan. That is about doing the same thing that you've always done or trying to do it at a time of a national pandemic. So folks, we got to really think about this. Every part of your work that can continue to be telework protects your people, protects your workforce. So let's make sure that we have fully thought through how different things are going to look and things are going to feel until we reach that vaccine phase. Our ability to do this is all about reducing contacts, making sure that we take extra safety precautions. And again, if you want to be the exception and try not to do the required steps, what you're going to cause is a spike within your own office, which will cause people to be self-quarantined, and it may cause a spike here in Kentucky, which may make us pull back. So please, as we move forward, especially if you were on May the 11th, it's not just the top 10 rules which we'll go over and your industry guidelines. Think about your own office, those employees or your customers. They're important to you. They're important to me. They're my people. I'm responsible for them as governor, and I want to make sure that they are safe. So we're counting on you. Each of you has been a big part of Team Kentucky. We need you to step up and to be a big part of Team Kentucky in this phase. Top 10 rules of healthy at work. These are some of the things that we're going to need to see from all of our employers and workplaces as they open up. It'll come up in just a second. We can't blame this one on Kenneth. All right, it'll come up here in just a minute. But our healthy at work includes things like universal masking. When you're at work, you and other employees, members, need to make sure you have one of these because your contacts are going to go up from right now being healthy at home, just having your individual family, to everybody at work and their families. So this helps protect other people. And I'm encouraging, strongly encouraging, folks to wear these when they go out to a grocery store or a hardware store in public. If you're just taking a walk, you don't need it. If you're going for a run, you don't need it. But if you're going to a place where other people are, remember, if you are in that grocery store and you're the one not wearing it, and you're asymptomatic and you cough on a bunch of stuff, then what happens with everybody else that's in there wearing one of these, preventing the same from happening to you? So let's just be good neighbors, good Kentuckians, and let's make sure we're doing what we can to make sure we're not spreading it to anybody else. All right, one of the first rules that everybody ought to think about at Healthy at Work is if telework is working, if it can accomplish the goal of that part of the business, we should keep it going. Phased return to work. Everybody can't be there on that first day. And you really ought to think of whether half the people should be there on the first day. Making sure that we ramp up and when we do this differently. On-site temperature and health checks. I know that there's some pushback out there on this, but you have to know if somebody infectious is coming in to your office. It's the difference of catching somebody at the door that you could identify, sending them to get a test, and then we do the contact tracing, and maybe in your office 1 or 2 people were in there. If you don't do these and that person comes in and they realize they have a fever in the middle of the day, they may have interacted with everybody in the office. And then what happens there? This protects employees. It also protects the business operations itself. Masks and other types of PPE, closing common areas. This is important. You got to look around your business where people normally like to talk and to congregate, something that we all enjoy at work, but something we can't do right now because we got to be healthy at work. Social distancing, limiting face-to-face meetings, hand sanitizer and hand wash stations, special accommodations. This is in everything that we're going to be looking at, from healthy at work, when you think about manufacturing, when you think about working at retail, and when you think about houses of worship. Those over 60 or with heart, lung, or kidney disease are still going to be at really high risk. And the White House plan suggests that they still stay just healthy at home. So making sure that you've worked through those special accommodations to protect folks. And then having a testing plan, meaning you know where to send somebody if they come in and are symptomatic. These are things that allow us to start reopening our economy, even in a time where we are facing a worldwide pandemic. These are things that keep us healthy. Let's buy into them. Let's not push back on them. Let's say if this is what it takes to make sure we can go back to work and not cause a spike in this virus, then that's what we ought to want to do. So I'm counting on you, Kentucky, and I know we can do this. I want to talk just a little bit about child care. And I said I wanted to graphically show a little bit of the reason that right now it's a piece we just can't do. And I know it's hard, and I know some say, well, we can't work if we don't have child care. Unfortunately, with the way this virus works right now, is if we have child care right now in the form that it was in before, we can't be healthy at work. It's unfortunate. Child care is something I believe in strongly, just like school. But we're at a stage where it's too dangerous if we want to be able to be healthy at work. Now, it's not in phase 1. We're going to engage in talks, and we want to hear different thoughts about ways we can do this differently and safely to potentially be in phase 2. But let me start with a little graphic about work. So this is a little bit about how our contacts are going to change as we go being healthy at work. And yes, this is going to be a really simplistic model. Yes, there's going to be different ways we can argue with it, but I think it shows graphically why we've got to do this carefully and some of the things we can't do. So if you're a family of 4, and we chose that because I'm in a family of 4, right now you're healthy at home, you have 4 contacts, and you do your best when you're out in public not to have others. But if we're going to go back to being healthy at work, and you have 8 coworkers you interact with, right, and they have similar families than yours, your overall exposure goes from your 4 at healthy at home to 32 at healthy at work. I mean, that opportunity of somebody's contacts can become your contacts. And what we want to do, why we're doing all the steps of healthy at work, is to try to minimize as many of those 32 contacts to work it back closer to probably 8 by minimizing how often you come into direct physical contact with folks in your office. All right, now let's look at daycare. So if you are that same family and your child goes to a daycare, and we just pick these numbers where there are 32 kids, right, and 4 teachers and staff, those kids you get all of those kids' contacts, the teachers and staff and their families, and the families of the children that are in the daycare. So your potential for exposure under a daycare model of this size, and again, real simplistic, goes from 4 at healthy at home to about 144 if we're talking about there. But now let's look at what happens if we have both work and we have the daycare piece. What you see here is you get them both. So if your daycare contacts potentially go up to about 144, and you're working with 8 other coworkers and they're doing the same thing, you can go from 4 very quickly to over 1,000. And so in trying to be, healthy at work, we've got to figure out this challenge to make sure that we don't take our contacts and immediately grow them exponentially. And again, a very simplistic model, but I hope it shows the challenge. And I really appreciate our child care operators. Reading a couple articles the other day, being very upfront about kids not being able to social distance, and they won't be able to social distance, and wanting to provide a safe environment for them. I want to work with you. I want to get to a point where we can do this, but this is the major challenge that we face in this area at Healthy at Work. Next, we've got our Adjutant General, General Lamberton, to talk about a special flyover that's going to occur tomorrow to honor all of our frontline heroes.
Thank you, Governor. We wanted to share with you that, as the Governor just mentioned, last week the Secretary of the Air Force initiated what we're calling Operation American Resolve. The purpose of Operation American Resolve is simply to show the respect and honor to all of the folks who've been engaged with some aspect of the pandemic response. Some of you may have seen it on the national news beginning a few days ago in selected cities and states around the country. There have been flyovers of various military aircraft, and in particular, they're flying over selected medical facilities, in particular to honor the folks who are the first responders and the medical practitioners in that case. We wanted to share with you specifically, and you can see the graphic over to my left, where tomorrow, beginning at 3 p.m., we're going to have 2 aircraft out of the Air National Guard wing flying a clockwise route around the state. They'll take off in Louisville, they'll fly over Frankfort, Lexington, Pikeville, Bowling Green, Owensboro, and return back to Louisville. And in each location, they're specifically flying over selected medical facilities throughout the entire state. And as I said, this is a show of honor and respect from the military to everybody from the first responders to the hospital workers to those essential personnel who've been engaged with the pandemic response at this junction. Quite simply, and to paraphrase our governor, is that we're all in this together and we will get through this together. Thanks, sir.
All right. Next, I want to briefly touch on a topic we'll go into more depth in tomorrow. But that's that this coronavirus hasn't just taken a human toll and a toll on our businesses, it's also taken a toll on our state budget. Today, our Office of State Budget and the Director issued his quarterly report where he predicts a very significant shortfall in our state budget. Just for this fiscal year, which ends at the end of June, it's anywhere between $319 to $496 million, and then additionally in our road fund, $100 to $200 million. These are significant, especially in the very end of a fiscal year, and it suggests that next year is going to be very difficult. Now, some people may think it's a state budget, but what does a state budget do? It's education, it's public safety, it's so many important programs that are absolutely critical, especially for those that are living paycheck to paycheck, trying to find that break where they can provide more security for their family. And at a time when benefits, when public assistance has never been more important, This is a real threat, not just to where we are right now, but it's a real threat to helping us rebuild. Without federal assistance, which I'll talk about in a minute, our recession will be longer, our unemployment will be greater. So all 50 U.S. governors are pushing, are lobbying, are pressing the federal government and Congress to include direct budget assistance to states and local governments that are facing the same thing. Remember, this type of assistance was done in the Great Recession. But what we're facing right now is a worldwide health pandemic that comes with another Great Recession. They did it then. They need to do it now. This is not a political issue. Even though it appears that there's back and forth between parties in D.C., all state and local governments, I believe, are united in knowing we have to have this if we are going to do what it takes to rebuild our economy. So I hope you will add your voice to your U.S. representative or senator. Make sure that you are heard. I had a conversation with our Senator McConnell, the majority leader, today, where I was able to express this need and talk over some of the numbers. I appreciate him hearing me out. Now I hope that he will be able to act in this next CARES Act to make sure that the type of relief that is needed is provided, just like I pushed to make sure that relief that's out there for our citizens, for our businesses, and others has been provided. And I know there's going to need to be more. So what we do in state government when this happens is we got to call in a consensus forecasting group. Those are economists that take our estimates and make an official estimate. Now that'll happen in the coming weeks, and then I'll advise you on the actions we got to take after that. A good announcement today with the SNAP program, the Supplemental Nutritional Assistance Program. So the big challenge here has been you haven't been able to use SNAP benefits to make online grocery purchases. And we want people, as much as they can, to do things like click list or online purchases. Well, the Cabinet for Health and Community-Based, the Department for Community-Based Services and the Cabinet for Health and Family Services were able to announce today that SNAP benefits can be used for eligible online grocery orders at both Amazon and Walmart. This is good. It's going to provide an extra level of safety. It's something we've been working on for a long time. We got over 500,000 individuals on SNAP. We want to make sure that they can take advantage of this in their communities. All right, want to do a brief unemployment insurance update before we hit our numbers. We got Josh Benton, who is here with us today.
Thank you, Governor. A few updates on unemployment insurance. Really, over the last few weeks, we've really changed our approach on how we're reviewing claims. With the high volume of claims, we're trying to eliminate as many times as possible that there has to be a manual review of a claim. Unemployment insurance is an extremely complicated program with a lot of different variables that determine eligibility. We have been able to reduce the number of variables that we have to review down to 4. And that primarily relates to employer separation issues and identity verification. There are some other things like fraud and overpayment that we have to look at, but these are the biggest numbers of claims that we have to review. So over the past week, we have decreased the number that we have to review for March down to under 28,000. Now those are 28,000 claims that we're going to get through as quickly as possible to determine eligibility so we can get those payments out and backdate them if those individuals meet eligibility. We're working through those day in and day out. Most of them revolve around an employer protest. If it was marked, their claim was marked as a quit or a discharge for the reason that they lost their employment. So we have to work through those things because for the two primary programs that we run, both traditional UI and the Pandemic Unemployment Assistance Program, employer separation is the final piece that determines eligibility. And just a quick note, as we're talking about, potential reopenings and people going back to work, there's going to be some information over the next week about how both individuals and employers can submit return to work dates and some exceptions. The governor just mentioned childcare. We're going to be flexible on unemployment insurance on two issues and probably some others, but specifically childcare issues as well as health issues, especially for those at high risk. So there'll be more information to come on that, but as manufacturers and others are looking at the 11th, we'll be providing guidance on reporting return to work dates and flexibilities on those programs. But for the rest of the March claims, we're going to be sending out an email to all of you all that we do not have identity documents for. We know that's about 9,000 people. So we will be sending out an email, hopefully this evening or in the morning, with instructions on submitting those documents so that we can get those claims resolved and moving forward. Our goal is to get those cleaned up and the payments out and make those final eligibility determinations. Thank you, Governor.
All right, so those are 9,000 claims that we want to get resolved. 9,000 claims that are just pending some documentation. Let's make sure that we get through those as quickly as we can. All right, let's go over today's numbers, and compared to other days, they are better than we've at least seen the last couple of days. Our total number of new cases today is 174, and really as we look at our numbers each day, despite more testing, we have seen them be fairly stable. They jump up and down, but generally in this range. When we remove duplicates, people who are out of state, our total number of cases in Kentucky is now 4,708. That is 4,707 lab confirmed and one probable case. These come from a total number of tests of 56,511. Ever hospitalized here in Kentucky, we've had 1,375 individuals. Currently in the hospital, we have 330. Ever in the ICU, 648. Currently, 178. That's up. That means there are more people that are in critical condition. So let's make sure that we think about them today and tomorrow and the next day until they're better. Our total number of recovered continues to climb, 1,675. We are grateful each and every day that that number goes up. New counties that these cases fall in: 27 in Jefferson, 27 in Kenton, 19 in Warren, 13 in Boone, 7 in Davis, Edmondson, Graves, McCracken, and Muhlenberg, 6 in Perry, 5 in Hopkins, 4 in Fayette, 3 in Callaway, Campbell, Grayson, and Hardin, 2 in Bullitt, Butler, Laurel, Leslie, Logan, and McLean, and 1 in Adair, Allen, Barron, Bourbon, Clark, Fulton, Grant, Jessamine, Knott, Meade, Nelson, Shelby, Spencer, and Webster. So those are the new cases by county. Again, the fact that we have not seen our cases on a day-to-day basis increasing, that we have not seen doublings over 3 or 4 days, or right now even a week. For about the past 3 weeks, we've been in generally the same area. That is good news when we look at something that would otherwise spread much more quickly. And that's because of you. I mean, the reason that for 3 weeks we've been all around the same place is because of your commitment and the work that you have done. And as you saw, confirmed by the UK study, you have saved lives. Unfortunately, we haven't been able to save everybody. So today, we have 5 new deaths here in Kentucky. And while that's lower than some days, remember those are 5 special individuals that are going to be missed by their families. The 5 are a 77-year-old male from Bath County, a 66-year-old male from Grayson County, 93-year-old female from Davis County, a 71-year-old female from Jefferson County, and a 97-year-old female from Grayson County. When we break down race and ethnicity of total cases, 74.53% white, 13.65% black or African American, 6.54% Asian, and a little over 5% multiracial. Ethnicity is 90% non-Hispanic and right under 10% Hispanic. Deaths. On the cases that we know, 79.43% white, 17.7% black or African American, just a little under 2% Asian, and almost 1% multiracial. Again, we read the numbers every day, and they can be a little numbing. And so we're trying to share stories of some of the special individuals that we've lost so that it continues to be real to everybody else maybe that hasn't lost someone that they know. That it reminds us that there are people out there that we're fighting for, and that there are people out there that we've lost. And just about each and every instance, the families of those individuals just ask us to do our best to protect others. And it's a very selfless ask at a time of tragedy. So today, we're going to talk about Jerry Mays from Owingsville. He passed away April 29th after a long, hard fight against the coronavirus. He was a loving husband to his wife Brenda for 44 years. He was a kind and devoted father to his 2 children, John Mays and Jessica Mays Bowling. He also had 4 grandsons, Austin, Alan, Alex, and Mason, whom he was very proud of. Jerry had an appreciation for hard work, and he lived by example. He mined coal, built homes, was a cattle farmer, owned and operated a nursing home for 31 years, and developed a mobile home community to house people in his hometown. He was a kind-hearted man who helped a lot of people. He wasn't your typical 77-year-old. He was vibrant and accomplished goals daily. He'll be greatly missed by his family, his friends, and his community. We appreciate Jerry and we appreciate everything that Jerry has done for this world and for his family, giving us the opportunity to honor him today and to let the rest of Kentucky know that we lost somebody very special. A couple of updates on areas that we've been providing news on. Green River, our mass testing continues at that correctional complex. 350 more inmates were tested today, bringing our total up to 630 plus. Testing will be completed tomorrow, meaning everybody at the facility or who works at the facility will have been tested. Long-term care facilities, a few less new cases, but it continues to be one of the major challenges. 24 new residents, 5 staff have tested positive since yesterday for COVID-19, and we've had 2 additional deaths. So this is an area, again, where we strive to do better every day, but we know that this virus is just so deadly in these settings. All right, today we have with us Karen Czar, Mike Valente, Joe Ragusa, and Joe Sonka, and a couple of questions that have been sent in. I'll start with one of the written questions, and I'll go to Joe since he went last yesterday. First is from Phil Pendleton, who I think is sitting outside. We've had a number of people want to know about libraries. What phase and category are they included in? So we've had a plan for healthcare. We've had a plan for business overall. We're going to have a plan for government and government-related services that libraries are going to be in. So we will get that out just as soon as it's ready. No, we're working really fast and really hard. Our number one goal is to get the guidance for the May 11th openings up, but we're going to be working on this plan as we are doing that. Joe?
So the head of the Kentucky Restaurant Association talked to us today, and they said they submitted a plan last week and they never heard back from your office. and they were upset about not being in phase one. How do you plan to work with them and restaurants on when and how they're going to be able to reopen in Kentucky?
The question is the restaurant association sent in a plan. They hadn't heard back from us yet, which is true. Again, we're working as hard and as fast as we can, but we're trying to reopen an entire economy, which takes a little time. And how are we going to plan to work with them? Well, we're going to want to make sure that we get their input. We're going to want to make sure that we can address the public health concerns. I understand where the association is. They're supposed to push. But I think a whole lot of owners of restaurants out there, while they are in a difficult place, know the challenge of doing this safely. And it is a real challenge, especially where we are right now and trying to make a very phased reopening. We have seen examples where it can spread very quickly in restaurants, and wanting to make sure we do it right. I think the worst thing that any restaurant would want is to be the cause of an outbreak of COVID-19. I think that's not just a temporary shutdown, that causes a permanent to a facility. So no, we're going to be talking with them, but it's admittedly a real challenge, and other states are looking at it too. Ohio hasn't announced a date for restaurants. I believe they've got a group that is working to make that happen. There's some other states that have opened at 25% capacity. Now we'll see what that does, but there's some real issues there too. All right, next question. Is there any specific mask guidance for media outlets and reporters to follow? And when you're in public, you got to wear one. If you are fully socially distanced, doing year to camera, sure, I get. I do this without the mask, but I put it on right afterwards. To our media, you're going to be out in public. Make sure you protect yourself. But I would ask that you help set an example. I wish you could see the room here. Everybody in the room, media, National Guard, public health, folks in my office, everybody is wearing a mask. And I appreciate the media being a model for that. We need to show people that, it's uncomfortable, it's different, but it provides a significant level of protection for you, for your family, but it also keeps you from infecting others. So I would wear it. Again, when you're at work and you're not engaged in an activity where it would be necessary to remove it. But please, get that word out, model that good behavior. It's going to be really helpful. Karen.
Several church leaders have contacted us voicing concern about workers, particularly in the meat processing plants, especially the immigrant population, where there's also a language barrier.
Right.
What is the state doing to help ensure safety?
So there is significant outbreaks at our meat packing and processing plants. They're happening all over the country. They're happening for a number of reasons. The state is working with local health departments directly in these areas. We have had one facility that's been willing to close down for a number of days to make sure that they can go through with significant cleaning. We're working with some others that aren't as interested in taking those steps. My commitment is we're going to put the safety of the workers first. I'm going to make sure that our directives are that you shouldn't have to walk into a place that you know is dangerous, and that we ought to be taking those short-term steps to make sure that people can stay open longer. Now, we talk about food chain and food chain security, and there are those that think if you have to take a 2-day pause, that breaks the chain. Well, if you don't do it and it gets worse, you have to take a much longer pause. So it's about taking those steps. But the Department of Public Health is tracking all of these, is working directly with those local health departments, and we're trying to provide all the assistance, including some testing that we can. All right. What about people, these are for masks, who need to go out to a job or a public place like a grocery store, but have a medical condition that prevents them from wearing a mask? If you have a medical condition that prevents you from wearing a mask, don't wear one. It's okay. You're not going to be penalized. If it is going to cause you harm, then don't do it, and kids under 2 shouldn't be wearing them. This is us protecting each other as a community. So those folks that can't wear a mask are protected by everybody else wearing a mask. Yes, there are always going to be those that for different reasons can't. Let's the rest of us try to lift up and protect everybody who can't by making sure that we do. Nobody needs to have proof or a note for a doctor. This is something that there will be enforcement in the employment area, but questions are going to be asked, and you're going to be okay. And remember, in public, nobody's going to be fined, nobody's going to be arrested. This is a strong recommendation, but if you want to be healthy at home and healthy at work, it's something we need you to do. It's another part of your duty. And when we're talking about defeating a worldwide health pandemic, I hope this is something you're willing to do your part.
So I know we're testing more here in Kentucky, but I think there's some confusion amongst people here and frankly across the country where they see their governors talking about these reopening plans, yet no state has really met that 14-day downward trajectory, which was one of the benchmarks here. And I know you mentioned looking at a 3-day average, but do you anticipate we'll see that 14-day trajectory before, well, I guess May 11th is less than 14 days.
Well, the question is, will we see the 14-day decline by May the 11th? The answer is maybe. We believe that we've been holding steady on overall numbers despite there being more testing. And that's with us now testing more people in populations such as long-term care facilities. So there's a lot of the numbers that you've got to look at. What I believe is that by doing a very gradual and phased reopening with strict guidelines, that we can do it safely at a time that we know where the contagion isn't increasing, that we're not on the increase, and I believe that we will see that we are on the decrease in May. Again, the numbers have to bear that out, but we have now been plateaued for about 3 weeks, and if we're running a couple weeks behind other places, I think that they are seeing their numbers changing gradually. Again, we wouldn't be doing it if we didn't think it was safe, and everything's dependent on the virus. I mean, folks, we're trying to take these steps, but if we have a spike, you can bet we're going to take the extra steps to protect everybody. So just like we come together day in and day out, we'll be looking at it day in and day out to make the very best decisions that we can. Question on more specifically what's included in retail, opening on May 25th. We're going to be providing more guidance on that. The question is, does it include shopping malls? And that creates a real density issue. We're going to want to work with the Retail Association on that, but there's going to have to be some extra steps on the shopping mall question to make sure that we can get a sign-off from Public Health. Viewer asked if there are plans to distribute free masks in Eastern Kentucky. Yes, they're going to be handed out at the Ashland testing site that we need more people to sign up for. This is centrally located. Well, it's not centrally located, it's on the east, but it's off of 64. We want as many folks in eastern and northeastern Kentucky to make sure they take advantage of it.
Going back to the White House benchmarks, where is the state at in terms of hiring people to do adequate contact tracing?
Question is on contact tracing. We have our plan in place. We have started, we have 3 levels that we're hiring for contact tracing. It's going to be a little over 700 people. There's the new folks that'll be working at the state, again, for just the period of time that it pays for. There's going to be regional groups that we create. DPH is working directly on those. And then we're going to put out an RFP, which we are finalizing on that last piece, and that will be the support. It's going to be provided to local health departments on contact tracing. And I'm going to be talking personally to the local health departments. This is new, but we want to create a solution to where we can move people immediately where there's been a larger outbreak. In other words, if we have fluid staff that can help in one area and then even move to another, so that it's not just simply by population, you get 1 or 2 extra people helping and then you have a whole bunch of extra cases. We want to make sure that we do this as well, but also as fast, which presents challenges, as fast as we can. We believe that we will have that workforce together in time. Do we have a timeline for COVID-19 testing sites in Northern Kentucky region? We're actually waiting on a proposal that we hope to have sign off on tomorrow. But we have been working since we had one of our very first testing sites in Kenton County with the hospitals and healthcare providers in Northern Kentucky doing some significant testing, especially in the senior living facilities. But our goal is to ramp up our capacity to be doing north of 20,000. We hope to be north of 24,000 tests. It's one of the ways we can make sure we protect the vulnerable populations. We protect our first responders and healthcare workers. We are able to test the general public, and then employers have the ability to quickly send somebody to get a test to protect their workplace. Joe.
I have a follow-up again on the revenue shortfall. If there is a $500 million shortfall by June 30th, what specifically does that look like for the state? And when you asked Mitch McConnell that, did he say, yes, I'm going to deliver that, or what did he say?
The two-part question. The first is on my conversation with the Senate Majority Leader, our Senator Mitch McConnell, and his response. He said he understood and that there were more discussions going on in Washington, D.C. But he heard me out. He understands the request. I think he understands why I believe it's so important. And the numbers are the numbers, so I hope that he will reach an agreement with those he has to reach an agreement with to ultimately make a stimulus package for state and local government and our budgets happen. I don't believe he is close to it. I think he wants to see other things in an ultimate bill. So I want to push for the things we need. I don't want to be in the middle of a Washington, D.C. negotiation or debate. That's not a place that I think many people want to be. But I certainly hope it is going to move forward and happen. The question about African American communities being impacted at a disproportionate rate, being linked to a lack of resources and accessibility in those communities. We're providing more testing, which is mentioned here, but has there been discussions on a plan to create change in the future? With leaders in those communities, we've been having conversations about the fact that there are hundreds of years of inequality have led to this point. And I hope one of the things that comes out of this is real, serious, significant change about breaking down some of those inequalities, especially in access to health care. It's something that I'm committed to doing. Admittedly, we're trying to address the inequalities in this crisis, which is taking up the vast majority of our time. But we got to fix this moving forward. Let's not let another 5 years, another year pass that we're not taking real steps to fix an injustice. Did we go this way last time? Karen.
We've had some people concerned who are still waiting on unemployment. So Josh, this may be for you. We've done so many stories on scams. If they get an email, how can they identify if it's real? And some people have gotten, say, their first check, but they're 2 or 4 weeks behind. Should they contact you, or is that en route?
We'll let Josh answer that one. We in the last 4 days, and he can give you the details on this. We've done a number of things. One was 150,000 claims that weren't new claims; they were issues like that. So there are a number of dollars and checks in the mail on folks that had gotten a check before, but there may be an issue with the claim. And then those that are the most recent claims. Josh.
Thank you for your question. So you're right. The issues that we see on claims aren't always on initial claims. They're on repeat claims as well. So what we are doing to address that is on a weekly basis. Most of these things can be fixed within our system. So they're common errors that we can just clear out. So the governor mentioned the 150,000 that were cleared this week. We are going to do that just on a weekly basis, where we can go through and clear out those common errors. Most of them have to do with the question involving returning to work. wanting to know if are they able and available to return to work. And so UI law states that to be on unemployment insurance, you have to be able and available to return to work. So if someone answers no, that stalls their claim. We have to ask the question, but we're treating everyone right now as able and available. So we're clearing that out on a weekly basis, and that should take care of most of the reoccurring issues that we see.
And as far as emails, is there anything that they should look for?
If it's from a ky.gov email address.
Thank you.
And to our partners in the media, if you hear of scams, especially if somebody using the state to scam, let us know. We want to get it out, and we need you to get it out. More details about specific capacity requirement churches will have to follow. We want to work with our houses of worship to establish that number. And it's one that I want to be able to have that discussion, because I asked my pastor today, I said, what's our capacity in our church? And we've got at least one area where it's 700 and something. But as we think about that room, we don't want half of that. And so it's one where we want to talk to those that run small and those that run large churches. Everybody wants to do it safely. And it's got to be not just a capacity number, right? Because that's where you start. But within that capacity number, you have to be able to social distance. And when you think about social distancing, you want each family unit to be at least 6 feet apart. But if we're going to do what we like to do in church, which is sing, you don't want to have somebody right in front of you either. And you got to think about choirs, because we know it spreads that way too. I believe that by May, I believe it's 25th, which is our date, our May date, our May 20th date, I think, for resumption, that we will have not only the right plans in place, but they'll be well thought through, and we will have buy-in from our faith communities.
Obviously, prisons and jails are potential hotbeds for the disease, but there are a lot of families who haven't seen their loved ones inside since early
Right.
March. Would you consider taking a staggered approach where families can come inside under tight restrictions and see their loved ones? I think there's a lot of people wondering just
Yeah.
when they'll be able to see them again.
Now, the question is on visitation in our jails and in our prisons. As we've seen in Green River, when this virus gets in one of those facilities, it can certainly spread. That's why we're testing everybody in them. But across the state and through our jails, we actually haven't seen, if you look at the number of different facilities, that many cases, and the reason is because of shutting down the in-person visitation. We're going to have to be very careful about lifting that right now in any form or fashion until we have, until we see some much better data, or we have a much better ability to do that safely. I know it's hard, but it's the safest thing for the inmate or the individual that is in jail or in prison. It's the safest thing for the staff, and it's the safest thing for the family that would then come into contact with how all those contacts spread. And we're having to do a lot of things that are hard. We're having to. And I'm giving a lot of answers I don't like giving. I'm a big believer in child care and early childhood education and in-person classes and so many that we haven't been able to do to date. But to do this right is gonna mean we have tough answers that we have to give.
In regards to masks and other personal protection equipment for businesses that are reopening, I know a lot of these businesses, and even some of the medical offices as well, especially them, they donated a lot of their masks and a lot of their PPE or anything else that might be now needed to reopen. So given that, we're going to see a flush of this happening, and we're probably going to see a rush of people trying to acquire PPE and masks specifically, what guidance or help do you give to those businesses who may have donated the PPE in terms of getting that stuff back to actually reopen?
The question is about businesses that donated PPE. Thank you for that. At the time that it was donated, it was virtually impossible to secure it on the private market. And the donated PPE went to those frontline healthcare workers that were walking in to COVID wings, caring for patients that had the disease and needing the best of the best protective equipment to make sure they weren't getting and or transmitting the disease. It is now a little bit easier to get certain types of PPE, and I know that the Kentucky Chamber, as well as others, are working to try to establish different supply chains for it. Those donations were absolutely critical when we asked for them, and I know people were glad to help. And yes, now they're going to have to go out and find more, and I know that creates a hardship. It means what they did was selfless, and now let's make sure that we can do this safely and not having PPE. I mean, as the person opening the business puts you at risk, and also puts patients or customers. Any help that we can provide in the private sector and connecting folks, we want to. But right now, our supply has to be there for healthcare. We got to do two things. Number one, make sure that we can provide to hospitals or long-term care facilities that are submitting their burn rates, and we're able to provide it when it's critically needed. But the second thing we've got to do is we've got to plan for another surge to make sure it doesn't happen. Warren County's seen a significant increase in cases recently, but it is not in long-term care facilities. We are looking at some of the reasons behind that. Obviously, it is a larger population than many places. Certainly, the region around it has some of these meat processing and meat packing plants, but definitely working through whether there are any particular issues that are also contributing to the spread. I'll do one more real quickly from anybody who's got one.
You said nearly 10% of cases are Hispanic. Is the health department able to track any trends of why that's higher than the population?
Of overall cases, about 9.78% are Hispanic. I'll check with public health about where we see those trends or the spread, given that there is a much smaller population. Thankfully, on the fatality side, it's much more proportional. I'll get you an answer to that. Good? All right. Everybody, we've gone just a little bit long on a rainy Thursday, but I want you to again know that I'm hopeful. You have done an incredible job at Healthy at Home. We need your work to be just as great at Healthy at Work. We have shown that we can take on this pandemic, and I know in our next phase we can do just as well. This is our challenge, but we are up to it. Every day we've learned a little bit more, and every day we've taken some extra actions that have helped keep us safe. And we've now had to live around this virus for a number of days. And we're going to have to live with it being a part of our lives in one way or another until we get the vaccine. So let's be prepared. Again, if a mask is scary, let's breathe. Let's realize that it's just one small step that we can take. And we have done so much to help each other, to be a good neighbor, and to protect each other. Let's not stop now. When we look at our number of cases, even when you look at our numbers of testing, they are some of the lower numbers, especially for our population in the country. And that is because we have come together, united as one Kentucky. We'll do this next step united too. I close by just reminding you that we did lose 5 individuals today. Let's make sure that we light our homes up green, light our places of business up, our institutions. Let's ring our bells at 10 a.m. because none of us are alone. We're all in this together, and we're going to get through it. We're going to get through it together. So once again today, we have another rendition of My Old Kentucky Home.